we're going to be going over the Pharmacology Basics. So we are going to talk about some sources of medication information, the naming of the medications, and some basic terminology. It's important to understand these things. You're never going to know every single thing there is to know about every single drug. But what's important is that you know where to find the information if you don't know it. So pharmacology is the study of drugs and their effects or their actions in the body. So before we get started, there are 4 medication sources. The first one is going to be a plant source. So plants would be something like morphine or codeine. Those would come from the opium plant. Atropine, which comes from belladonna, and digoxin, which comes from foxglove. You also have sources from animals. This is going to be like your insulin and oxytocin. You have mineral sources. That would be your bicarbonates, calcium chloride, magnesium sulfate. And then you've got your synthetics. This would be like your adenosine, your diazepam or Valium, and some of your vaccines. It's also important to know where to get information about your medications if you don't know everything you need to know about them. So your official source is going to be called a pharmacopoeia, and this is going to include the United States Pharmacopoeia and the National Formulary. There are other ones, but those are the 2 primary ones we use here in the U.S. Now your compendia is a non-official source, but still a good source of information. This would be like your hospitalary formulary services, your dispensing information, physician's drug reference or PDR. This one's a massive reference book if you've never seen one. The internet can be a good source, but you have to be careful. Just as much good information as there is out there, there's 5 times as much bad information. So make sure that you're using a reputable site if you are using the internet. Don't just Google it. Okay, so you can go to drugs.com, rxlist.com, WebMD, Micromedics is a personal favorite of mine. And then your smartphone apps, once again, there's some good ones out there like Epicrates, MedMath, things like that. And then there are some bad ones. So be careful which ones that you're using so that you can make sure you are using an appropriate. When we're talking about medication names, there are 4 basic types of names that you will see associated with medication. So the first one is going to be a chemical name, and this is a precise description of their chemical compound and molecular structure. I'm not even going to try to pronounce that, but you see there's some numbers, there's letters, there's a whole bunch of stuff there. Okay, this is usually used more in the literature and prescribing information. Your generic names, this is an abbreviated form of the chemical name, and it is actually selected by the United States Adoptive Names Council that makes the generic name for the drug. It's also important to note that it is not going to be capitalized. Now for the trade name, this is chosen by the manufacturer of the drug. It will always be capitalized, and it is actually protected by a copyright, and it is considered to be a proper noun. Your official name is going to be followed by the letters USP or NF, and that's for the United States Pharmacopoeia or the National Formulary. That follows the standards set by that publication. Alright, usually the official name is going to be the same as the generic. It is important that you know your generic and your trade names because a lot of times they're used interchangeably. For instance, like Tylenol and acetaminophen. Tylenol is the trademarked proper noun trade name, but acetaminophen is the generic name. Now, how many times do you hear somebody, oh, do you have any acetaminophen I could use? People typically call it Tylenol. Do you have any Tylenol? Whether it's actually Tylenol or whether it is Walmart brand acetaminophen. Now, when we're talking about medications, we want to make sure that we know the components of a medication profile. And profile is just all the things you need to know about the medications that you're going to be giving. So you need to know the names, generic and trade. You need to know the classification. What type of medication is it? Is it an antiemetic? If you need one and you don't know what an antiemetic is, then you're going to have problems selecting one. You need to know the mechanism of action. Anything that you're given, you need to know how it works in the body so that you can know if it's going to work in the body. You need to know the indications and the contraindications. Indications are why we give something. Contraindications are why or when we do not give something. You need to know the pharmacokinetics, what it's going to do in the body, how it's going to get in there, what your body's going to do to it. You need to know the side effects or adverse reactions. For instance, nitroglycerin can cause a blood pressure drop. Well, if you don't know this, then you don't know to monitor the blood pressure specifically after giving nitroglycerin. You need to know the dosage, obviously. You need to know how it's supplied. Does it have to be reconstituted? Is it a tablet that's chewed up? Is it a tablet that dissolves under the tongue? What kind of, medication is it? And then any special considerations. Is there anything we need to know about this? For instance, adenosine has to be given really, really fast. If you don't give it fast enough, it will have no action within the body. The half-life is so short. So these are the types of things that we need to know before we give a medication. As far as abbreviations, there are tons, way too many to list. So I'm going to put a link in the Canvas module for some of the more common ones, but it's important when you're talking about abbreviations that you use commonly accepted ones. For instance, BS. BS, I'm sure you can imagine what most people think BS means, but somebody, if they were to document it as breast sounds, meaning breast sounds, it could be very easily misconstrued. So make sure that you're only using commonly accepted standard abbreviations when you are documenting things. And we're going to finish up with some basic terminology. These are some things that you just need to understand what they mean because we'll use them throughout the semester. So antagonism. This means an opposition between two or more medications. So basically something is stopping something else from happening. A bolus is just a single dose of medication, most commonly referred using that in reference to fluids, a fluid bolus, but it can be any medication. Potentiation means enhancement of one drug's effect by another. Refractory means it's not responding to a drug. So, for instance, if somebody is in VFib after you give them amiodarone, they would be considered to be refractory to amiodarone. Synergism is where the combined action of two drugs is greater than either one of their effects if given separately. So 1 + 1 = 3. A cumulative effect is when you have a drug that's given in several doses with an increased effect. So it has to get to a basic level of buildup within the body. Your enteral routes are going to be administered, drugs administered through the GI tract. Your parenteral are ways of the medications getting to the body without going through the GI tract. An idiosyncratic reaction is a different reaction usually seen from the rest of the population. For instance, Benadryl is a common one. So most people, if you take Benadryl or diphenhydramine, you're going to get sleepy. But if somebody has an idiosyncratic reaction, they might get really hyper and excitable and wide awake after taking Benadryl. Now, therapeutic action is just what we want to give a medication, why we want to give it, what we expect to happen if we give the medication. And then an untoward effect is a side effect that proves harmful to the patient.